When we say tick in the clinic, we're not talking about unusual twitches or the recurring beat of a clock. Usually, tick talk is about a group of blood-sucking and disease-spreading small bugs. Ticks are cousins to spiders, mites, and scorpions, and these buggers are not insects. Insects have 3 segments to their bodies along with 6 legs, while ticks have fused bodies with 2 segments and 8 legs. Ticks are distinguished by how they grab onto passing animals and climb upwards to find a dark, quiet spot to suck their victim's blood. Common carriers of ticks are mice, squirrels, cats, dogs, deer, and humans. Entomologists estimate that ticks evolved into blood-feeding parasites about 120 million years ago. 3,500 years ago, tick fever was described by Egyptians, and 2,500 years ago, Homer wrote about ticks on Ulysses' dog. These bloodsuckers are found throughout the world, especially in warm and humid climates, with a 4-stage and 1 to 2 year life cycle before the female lays her eggs, starting the cycle all over again. At each stage, ticks require a blood meal. And be warned, most illnesses are spread by the tiny, smaller than a sesame seed nymph. Ticks carry various infectious diseases which they inject into animals and humans. Every year, more than 40,000 cases of tick-borne illnesses in humans are reported in the U.S., but the CDC estimates that 10 times that number go unreported. The worst news is that ticks are expanding their territories, and the diseases that they spread are increasing. In our part of the country, we have the American dog tick, often incorrectly called the wood tick, which carries Rocky Mountain spotted fever and tularemia. Nearby in Minnesota and Wisconsin, the black-legged tick carries Lyme disease, ehrlichiosis, and babesiosis. In the Black Hills, Colorado, and Montana, the Rocky Mountain wood tick carries Colorado tick fever. We encourage outside activity, but prevention should happen whenever going outside into grass, weeds, garden, or woods. In the spring and summer, tuck pants into socks so the buggers can't climb up into private areas. Apply tick or mosquito repellent on lower clothing, and check for ticks at the end of the day. Remove these suckers with tweezers, pinching at the mouth attachment and gently pulling until she lets go, while avoiding squeezing the body of the tick. Antibiotics should be started if any rash, fever, or illness follows a tick bite. Spring is coming soon, so be prepared for a tick attack.